Hi, good morning, everybody. This is Justin Hahn, Washington Wellness Program Manager here at Healthcare Authority, and I want to thank you all for being on the line today to hear about and then to hear from you about 2019 workplace wellness. So we're very excited to present this webinar today. So first, a little bit of housekeeping. So we're using GoToWebinar today, and if you need to use the bathroom, go ahead and use it at any time because you're sitting wherever you are. That's a funny joke from Justin, so feel free to laugh. We have everybody muted, so we're going to keep everybody muted because of the issues that sometimes come up with audio between voice over IP and people just calling in. So the way that we're going to do this today with regards to questions, as you watch the webinar today, we're going to have Q&A sessions for each one of the sections that we have, and I'll outline what our agenda is in just one moment. So if you have a question that occurs to you, go ahead and type it into the text box, the question box there in the GoToWebinar sort of square there. So submit questions through there, type them in, we'll see them come in, and we'll address them towards the end of each presentation as well as at the end of the overall presentation. We'll have some time for that too, which I'll describe in a moment. We have what did I want to say? We're going to be recording this webinar today, so this is a recording, so just so everybody knows. And yes, if you have any technical issues, please go ahead and put those questions into the text box, and we'll see what we can do for those issues. Okay, so let's go ahead and get started. Like I said before, my name is Justin Hahn. I'm the Washington Wellness Program Manager, and Washington Wellness, per Executive Order 1306. One of the things it says, among many other things, it's an executive order that Governor Jay Inslee signed in 2013, beefing up our statewide response for public employees with regards to workplace wellness. And it puts Washington Wellness right in the middle there with all of you all with regards to providing structure, technical and training assistance to agencies. And it specifically says agencies, but we like to, even though it's required for agencies, we like to have this flow out to all of the PEP organizations, including higher education institutions as well as political subgroups. So wherever you might fall, we have something for you within those categories. And it's also, just interestingly enough, 1306 was the thing that started SmartHealth. So if you're not too familiar with that, go ahead and Google that or ask us via email for more information about that. I just want to acknowledge that wellness coordinators are key, so key to supporting workplace wellness. You're on the forefront of wellness promotion and workplace wellness culture change. So it's not only promoting, doing the work, it's actually living it, because that's the best way that we can do it, by taking care of ourselves, our own well-being, and being a model for those around us. And of course, it's not only for you, but it's for your fellow employees, as well as what we know from research around leadership, especially supervisors and managers, understanding and knowing what well-being is and how it can be applied at the work site. So we're going to talk a little bit about that later in Pam's section under training. But I just wanted to express my heartfelt appreciation to you all for what you do and for being on the call today. So, okay, so let's go ahead and go to the next slide. So the presentation agenda for today is just went through the introduction. We're then going to flow into the diabetes prevention program powered by Omada. This is our exciting new virtual diabetes prevention program online. Then we'll spend about 40 minutes there, then about half an hour on 2019 SmartHealth. So these are all the resources, the updates on the platform, but also the resources that wellness coordinators can use and leverage on your end to promote SmartHealth to your employees. And we have some things that have remained static and some new things that I think you're going to be very interested in. So, and then we're going to spend about 20 minutes on wellness coordinator training and technical assistance, just to give you an idea of what we're doing, how we're approaching training and technical assistance, and some of the things we've done and some things that are coming up. And then we're going to have an open Q&A about towards the last 20 minutes. So we'll see how that goes as far as the timeline. We'll see. Okay, so to round out the introduction here, I wanted to provide you a little bit of background about how we, in a general sense, describe the work that we do. So very simplistically, we talk about it as a goal and strategies that support the goal. The goal is to build, grow, and sustain effective worksite wellness programs to maximize individual and organizational health and well-being. So we really see ourselves in our role as providing as much assistance to you all, and so that you feel empowered to realize your work there at your local organizations. And so we support you, but we also promote tools like SmartHealth and DPP to public employees directly as well. And then the strategies that support that goal are things like evaluating the data to characterize the population. And so that's, looking at SmartHealth data, looking at diabetes prevention program data, and there's much more data, a lot more data that we have. Developing and implementing and monitoring evidence-based population-focused approaches. So again, looking at sort of the outcomes, developing and then monitoring and evaluating like SmartHealth, DPP, tobacco cessation programs. Looking at the 8 steps that you can get an award for the Zoate Award with regards to just building and maintaining a best-in-class wellness program at your worksite. Develop worksite wellness capacity. So that's really that training of wellness coordinators and the best practices that we glean from the world of wellness that we have access to here and beyond. Also, with regards to Healthy Worksite Summit, scholarships and just working with the Association of Washington Cities to put that on. And if you haven't been to it, it's coming up here in March 2019. It's a really exciting and inspiring opportunity for worksite wellness that's local here in Linwood. So, and then engaging the target population. So we promote direct and indirectly through our wellness coordinators, all of these things that I mentioned before and more. And also then maintaining and improving Washington wellness operations. So that's building our internal capacity to sort of making sure the lights are on, people know what they're doing, but also taking care of our well-being. So it's an important thing to do, because if you're not there for yourself, you really can't be there for anybody else. So I really encourage you all to take that as seriously as you can, as I try to do every day as well. All right, so without further ado, I'm going to hand it over for to the Virtual Diabetes Prevention Program updates, and I'll let our team here take it away.
Hi, good morning, everyone. This is Ron Kim. I'm a health promotion consultant on the Washington Wellness team. In a few minutes, I will be handing it off to Ben Smith, who's been kind enough to join us from Omada, and he'll be diving deeper into what this new program, or version of the program, I should say, will look like. So the 3 key areas that I'm going to cover with you this morning, we're going to talk about why DPP, right? Why is this coming to you? What it is, and how you can definitely help, which is such a key part of our work. We really do rely on your efforts at the work sites to carry out and execute and let your staff know about some of these great benefits available to them. Okay, so why DPP? Justin mentioned already, it is part of Executive Order 1306. For those of you who aren't familiar with it, if you go into the current version, I believe it's section 2B, that you can kind of find out some details about how it's called out as a key tactic to try to essentially improve the health and productivity of employees, which has an organizational benefit of improving results, right? So it's both helping the staff and the organization. All right, some of you are probably familiar with how DPP has gone in the current year and in the past, but just in case you aren't, we essentially had 2 different options to kind of bring this to your folks. One was in-person testing events. And we realized that coordinating and planning these events, it took a lot of effort, actually. It took lots of planning. You throw into the mix the fact that not all employees work the same schedule, that you have employees in different work sites. It really does kind of make it tough to hold a central event and yet make it inclusive for all your staff. So we realized that, and as a second option, because we realized it was tough, is we actually had what we called a risk quiz. And the way that worked, it was a simple paper form. people can answer a series of 10 questions, and if they fell into the eligible range, they dial a number and they take action from there. An issue that crops up with this current format is the fact that it's one thing to get tested or find out you're at risk, but the second half of the equation was that then people had to find time to attend a DPP lifestyle class. And this is where it's kind of difficult with all of our different schedules, where we're located, finding a fit for everyone at the right time wasn't always easy. And so, some people, although they found out they're at risk, they just might not have been able to get into a class that fit their lifestyle at that time. So in terms of what's staying the same, actually quite a bit. It's still going to be very similar in terms of the like who's eligible. This is going to be open to PEV members and eligible spouses and dependents if they're a certain age. So that's staying the same. There's not going to be an extra cost to the member. This is a great part of your benefits package, so they don't have to worry about that piece. And it is also based on the same CDC program. So what's new for you in 2019? What I'm referring to is you specifically in your role as a wellness coordinator or a health promotion champion at your work site. So from our perspective, what this new platform is going to make available is the fact that it's going to be much easier to plan. Basically, all the in-person testing events, those are going to go away. So really, it's a matter of just focusing on one specific way to promote this benefit to your staff, and that is using the tools and resources that we're going to make available to you. We have a few examples that we're going to share with you now, but we will be adding more as we kind of learn as we go. So this, for example, is what we're calling our DPP flyer. You'll see other variations of this, and you can find all of these on our Washington Wellness Diabetes Prevention Program webpage. We have the address for you there. We'll preview it, but I want to make sure that you understand that we have a webpage dedicated for you in your role as a wellness coordinator to access resources, but we also have a separate diabetes prevention page that is really geared toward your staff in terms of learning more about the benefit. And I think sometimes there's some confusion in terms of which one's which, but just kind of walk away knowing that you have one specifically for you for resources and one for the members. And here, we'll go take a look at what that looks like right now, and maybe even a second example of a promotional resource we created for you. So here it is. This is within the Washington Wellness section of the Healthcare Authority website. And as you scroll down, we definitely talk about why this is important, referencing that executive order, what it is, and who is eligible, bouncing you back to that member page to find those heavy details. And for those of you who remember this page before, in terms of the how to promote section, we had a long list of things because of the fact that, well, it really depended on whether you're trying to host an in-person testing event or you're trying to just simply focus on promoting the risk quiz. Now going forward, you can see we have a message, a flyer, posters. We'll be adding a video that I think will be a great option to get the word out to folks. But one thing that I definitely want to stress to you is the fact that this new version of the diabetes prevention program isn't going live until the new year. So we wanted to make this available to you now so you get a sense of what it looks like, so you and your team can start planning and thinking about, which option makes sense for you. But to remind you to please wait until the new year to promote these to your staff. That way they can take action right away. So that's definitely something to walk away from and realize that the benefit itself, the new version, isn't available to the new year. So although we appreciate your willingness to just get on board and start promoting, we really do ask that you wait until that time to start communicating this. But to give you an example of a second promotional piece we have created for you, we're calling this the digital sign. And so for those organizations or agencies that have something like a TV in a hallway or in a break room, this is a great tactic that you can use to basically let people know about this new benefit. What you'll realize as you click on each of these, that they definitely have unique look and feel. So we want to give you some variety to choose from and let your team decide what makes sense for you. But just realize that you really don't have to touch any of these resources really, that they really are ready to use as is for the most part, okay? So I'm gonna give Aaron a second here to jump back into the presentation. I think slide 10. Okay. So that's what's new for you. Now we're going to be focusing on what's new for the member. So I kind of touched on it briefly. It's all going to be online now. It's an online experience that's really going to kind of meet your staff where they're at. It's going to give them much more flexibility, not only to engage and find out if they're at risk, but really the whole class experience, which is such a key part of this, right? It's one thing to get tested, it's another thing to go through the program. And because it's online based and the way it's structured, and Ben will go into it in a moment, they really are going to have way more flexibility than they have in the past. And another cool feature is a welcome kit that comes to them. I won't go into too much detail. There's pieces like a digital scale, kind of like a nice package, a present to help them get started on their journey. So we're gonna just take a moment to transition and give our partner a chance to walk through these next pieces for you. But he's gonna go into more detail about you know, what this looks like, what to expect, and then we'll hopefully have some time for some questions as well.
All right, thank you, Ron. Can everybody hear me still? Everybody can hear me all right?
We can hear you. Thank you.
All right, fantastic. All right, so Ron alluded to this already, but just want to make sure everybody's aware of the value here of the virtual diabetes program. So scale alone has a tremendous impact. Traditional in-person DPP programs, they're limited to a specific geographic location. You've got to be there at a specific time of day as well. And so depending upon whether or not that's flexible for your schedule, that'll have a significant impact on whether or not you can attend those meetings. The great thing about this program, any internet connected device can access the platform. We have an app for both iOS or Apple as well as Android. The other great thing is personalization. We collect a number of data points and we can personalize the program, tailor it to each individual from not only the content standpoint, but coaching and the tools that you're able to utilize as well. And behavior change is ultimately about engagement. We've got to change behaviors that have been established for years, if not decades. And that's going to take time, and that's going to take a number of touch points. And the great thing about our platform is we deliver, as it says, record-setting engagement. It's not uncommon for folks on average to interact with our platform upwards of 20 to 30 times in a week. And so that ultimately is what's going to lead to long-term sustained behavior change. So in terms of elements of the platform, I want to make sure everybody's aware of what's involved. A key component, again, as I mentioned, is the app for both iOS and Android. We have a support group that you'll be connected with as well, similar to an in-person program. You're going to have a peer group that you're matched with. You'll also have a health coach. A crucial component of the process is a digital scale that comes with the program. It's actually already connected to your account. So all you need to do when you receive the scale is put the batteries in and step on it. And essentially we have a direct line of communication in terms of mapping your progress. There's no connection to Wi-Fi, there's no hookup to Bluetooth, nothing complex in terms of managing that connection. But the key things that we're gonna work on are 4 key areas. that are ultimately going to lead to getting off the path of chronic disease. So number one is going to be nutrition. A majority of the lesson plans are going to be start with a focus on nutrition. We're also going to touch upon activity, managing stress, and then getting quality sleep. All four of those components have a crucial impact on an individual's likelihood of getting diabetes or chronic disease. In terms of, are we certified? Absolutely. We have full recognition from the CDC. We're the largest DPP provider, not only in person but digital, to achieve this recognition. And we constantly have to stay up to date. We're reevaluated every 6 months. So I want to walk through the overall experience of the user. Let me see here. I wanted to hold off on that video. We'll hold off on that till the end. See here, let me connect to the next slide. I'm having an issue here. Moving on, I apologize. Hang on for just a second. All right, my apologies there. So in terms of who's eligible, there's some criteria that individuals will have to fulfill in order to be eligible for the program. So key risk factors, number one is obesity. In addition to that, if an individual has prediabetes and they're overweight, they are certainly would be a good candidate for the program. In terms of communications, we have an entire team dedicated to having maximizing outreach to the population, maximizing enrollments, and making sure that we're providing communications that are relevant to the individual participant. And Ron alludes to some of that in the toolkit that we're going to provide, but rest assured we have very high quality communications that are going to be available. Now let's walk through the overall journey of the program. So in terms of preparation, all of our marketing materials are going to be directing individuals to a landing page, which again will go live in January 2019. And from there, they're going to apply to the program. Once accepted, they're going to receive a welcome kit in the mail that's going to contain that scale. But let's walk through some of the key components. So again, the lesson plans, that's a crucial component of the platform. There's a new lesson each week. An individual can complete that lesson plan on their own time. There's no specific deadline in terms of a given time of day, day of the week. It's on your own time and at your convenience of when you can go through that lesson plan. Varies anywhere from 10 to 15 minutes or so for each individual. And we try to touch upon a number of different learning strategies. So there's game components to the lessons. There's helpful tips and tricks in terms of managing how to navigate the grocery store, how to cook healthier meals. So all of these will provide you with the tools and skills to improve your healthy behaviors. All right, and again, as I alluded to, each week there'll be a new lesson plan, and you can always go back and look at previous content. Another crucial component is going to be your health coach. They're there to guide you along the way, to provide helpful feedback in terms of your behaviors, and they're there as a resource. You can always reach out to your coach, get their feedback. In terms of tracking the weight, tracking your nutrition, you can actually track your nutrition as easily as taking an image, taking a picture of whatever meal you had that day, and your coach will provide you feedback on your meals, so hopefully get you on the path to healthier nutritional habits. As I mentioned earlier, you're going to have a peer group. They're there not only as a support network. These are individuals that are on the same journey as you. They want to lose weight. They want to get off the path of chronic disease, but they're also there as a little bit of friendly competition as well. So you can see on screen, we've got some images of participants there. You're welcome to disclose as much or as little about yourself as you like. It's not uncommon for folks to, if they don't want to put an image of themselves, they can put an image of their dog or their cat. But you can see this graphic around their avatar there, and that's representative of where they are on their journey. So we don't disclose starting weight, we don't disclose ending weight, we don't disclose any of your personal information there. But what you do have a gauge of is where this individual is on their path to reach their weight loss goal. So you can get an idea of where you where you stand relative to your peers, and it's not uncommon for folks to develop a competition with somebody that they've never met or never interacted with, but they just pick them out of the group and say, you know what, I'm going to try to keep up with Dwayne, for example. All right, and then the first 16 weeks or 4 months of the program, as mentioned here on the left-hand side, is deemed the foundation phase. That's when you're going to be learning those new behaviors. You're going to be interacting with your group on a regular basis. You're going to be interacting with your coach. And then you'll move into what we call the focus phase, and that's weeks 17 and beyond, or 5 months and beyond. And that's at a stage where you continue to have access to new lesson plans. You continue to have access to a peer group and your coach. But at that stage, it's more about cementing those new behaviors that you've learned to make sure that they stick around for the long term, because ultimately what we're looking to do is have a significant impact on your health for weeks, months, and years to come. So let me walk through a little bit of the personalization component. This is Justin. This is an actual participant who gave us permission to use his image here. And I want to let everybody know, how do we go about personalizing this program? So Justin came in. He had an elevated A1C. His doctor recommended that he participate in a DPP program. We tailored the marketing to gender and age, and all of the promotion is complementary to his health benefits. In terms of the application process, we were aware that Justin had tried in-person DPP before. He's had decreased physical activity. We realized that he was senior in age, and so we tailored that group environment as well as interactions with the coach to match his life stage and age. The coaching expertise, again, was in the area of prediabetes. All right, in terms of personalization on a nutrition front, we are able to gather this data in terms of, what is his history in terms of nutrition, what is his history in terms of activity, and we can focus on key areas that he needs to improve upon. So we can customize his interaction with the platform to address his specific needs. Unlike an in-person program, you don't really have the flexibility to examine all these data points and take action and deliver a program that's customized to the individual. All right. Now, I believe that's the end of my slides here. Did we want to open up the floor to questions, or if we have time, I'd like to present that video, if we could. Ron, do you have a preference there?
Yeah, let's go ahead and do the video.
Okay. All right. Hang on a second. I'll switch gears. Let's see here.
And while Ben's working on doing that, if you guys have any questions, please feel free to use the chat feature or in the questions box. You can put in your questions there, and we'll try to go through them as we can.
All right. Can everybody see my screen with the video?
Yeah, we can see it.
Okay, perfect. I'll go ahead and play here.
Introducing Omada, a digital health program that uses a combination of proven behavioral science and rich data science to help build healthy habits that stick. If you're at risk for type 2 diabetes or heart disease, you're eligible to enroll. Once you're on board, we send you a wireless scale that's already linked to your account. All you have to do is this. Then, based on input you give us, we match you with a health coach whose job it is to monitor your progress, give feedback, and provide the personalized guidance you need to be successful. We also match you with a community of other participants a lot like you for added support, accountability, and sometimes a little healthy competition. During the first 4 months, you track your food and activity. Meanwhile, you take weekly interactive lessons that teach you how to make little changes that can make a big difference across 4 key areas that impact your health. And you gain skills that help you replace current habits with healthier ones. It's this combination of accountability, support, tools, and insights all working together that makes the Omada program so powerful. Within a few months, your thousands of data points paint a clear picture of what new habits are working best for you and where you need to double down on effort. Then you can work with your coach to focus on the challenges that are most critical for your long-term success. Omada provides personal support, powered by science, to inspire you to be your own cure in lots of tiny, totally doable steps. Are you ready to take the first one? Omada, healthy habits for life.
All right, one thing I wanted to note, we are going to provide an updated video. This particular program is not for heart disease, it is for DPP, so just wanted to make a note of that. All right, I will go ahead and hand it back off to Ron. Or did we want to have time for questions at this point?
It doesn't look like there's any questions related to the program. At this time, we do have another question that we'll address here in just a minute while we switch over. So one of the questions that we do have right now is, are the YMCA classes completely ending, or will there still be some folks that prefer that option?
So hi, this is Justin again. I want to thank Ben for that great presentation, and also for this question, for Catherine for this question. So with regards to YMCA, we are winding down our support of the in-person DPP program with our partnership with the YMCA. So it's possible to do, what has been done, what Ron described as, the coordination of testing events, setting up classes with the Y on site or wherever it may have been. As it was done in the past. That can happen through the end of this calendar year, but at the end, and any folks will that then test and in the pre-diabetic range and register for a class are able to go to those YMC classes as long as they're available. But starting in 2019, we're not going to be supporting the in-person testing and the coordination of classes, etc. So we're going to be wholly focusing on virtual diabetes prevention program. And I'll just say, if anybody has a question about this, we are able to accommodate folks who have been in the in-person DPP and want to switch over. So they'll be able to switch over to virtual diabetes prevention powered by Omada. So if there's any other questions, I don't know if there's any other questions, Aaron, that have come in while I was answering that one. But let's just pause here for a sec.
Yeah, we have one other question. Is this program confidential?
Yes, so this program is confidential. So this is protected health information as governed by the federal laws, including HIPAA. So we are just like with SmartHealth, the vendor, in this case it's Omada, does not share personally identifiable information with the employer through HCA or directly with the any agency that you might be working for. Only shares aggregate data that meets a certain HIPAA threshold with regards to the number. So even, they won't even report to us aggregate data if it doesn't meet a threshold for it being a certain number, so it maintains confidentiality. So we don't get personalized information, and we don't even get aggregate data unless it's so big that you can't drill down and figure out who that person is. So we take that very seriously, and yes, and I'll ask Ben if you have anything else that you want to add with regards to protected health information.
Yeah, you're exactly right. When we deliver reporting, it's at the aggregate level, and we have a minimum that you mentioned that has to be met so that individuals cannot be identified. And anybody with reservations in terms of sharing their identity at the group level, as I mentioned, you're welcome to provide an alternate image, whether it be of your dog or cat, and you can certainly use an alias in the group setting if you want to remain very private. But I'd never want that to limit anybody in terms of participation in the program. So feel free to disclose as much or as little about yourself at the group setting as you'd like.
All right, thank you, Ben. All right, are there any other questions, Aaron?
Yes, there is another question. We have a second to go through these. Is there a financial risk for the materials they send you, like the scale?
That's a great question. I'll go ahead and, Ben, do you want to answer that one?
Go ahead, Ben.
Yeah, so the scale is yours to keep. There is no need to pay back the scale or anything of that nature. It's yours to keep from participation in the program and beyond.
All right, thanks, Ben. Any other questions, Aaron?
No, I don't see.
All right. All right, thanks for those great questions, everybody. And if something occurs to you as we proceed, go ahead and just type them in that box there, and we'll get to them either during the next session or the next agenda item or at the end of the webinar. So, okay, so now we're going to move on from virtual diabetes prevention program, and we're going to be focusing on now on SmartHealth and 2019 SmartHealth to be exact. So many of you most of you hopefully are familiar with SmartHealth, but this is our, as I mentioned earlier, with Executive Order 1306. That's where sort of the governor really pushed this idea forward of having an comprehensive online, mobile-friendly health and wellness and engagement portal. So really, that really focuses on things that are good for the individual as well as the organization and the state as a whole as an employer. So this is part of not only the best thing to do, I think, as far as in a rational sense, but it's also a way of being an employer of choice within the state in a competitive environment between public and private employers. So we'll go ahead and go to the next slide. And actually, and Bennett is not on right now, it appears.
I am not seeing that.
So I'm going to pause this for a second here.
I'm here. I don't know why you guys can't see me, but I've been listening to all the great presentations throughout. Thanks for having me.
Excellent. Okay, so this is well, I'm going to hand it over to Bennett, and let's see, we're going to go ahead and drive for you, Bennett, but why don't you go ahead and introduce yourself, and I'll let you talk through the next slide. Thank you.
Hey, this is Bennett Blodgett. I work at Limeade, which is the company that powers SmartHealth, and I've been working with Justin's team for a little over 3 years now. And actually, we're going to spend a little bit of time, and some of you will have heard this before. I might be new to others of you, just talking about how we do what we do, why we do it, and how it's working. So we'll just give a little bit of preamble there to talk about that. And actually, one of the things I saw in the chat box was a question from Kathy Radcliffe about how the DPP program will relate back to SmartHealth. And I don't believe it was answered, but you guys can jump in if it was. And Kathy, to answer your question, and for all of you out there, we are definitely working in coordination with Omada to make sure that this is an activity that's integrated into the SmartHealth platform. And so users will be able to find out about the opportunity to participate, and we will have an activity that will automatically track. So once somebody gets admitted into the program, we're able to communicate confidentially with Omada and upload those activities directly to the SmartHealth platform and give them a certain amount of points. We're ironing out the details now, but at a basic level, that's how it'll work. So we're really excited to be able to help support this really important program and bring it to life in SmartHealth. So please feel free to ask any additional questions as well. So just to jump back into the slide here, we really think about SmartHealth as 2 prongs. So if you go back 1 slide, actually, it's good for employees and it's good for organizations. And so Limeade has a very strong point of view, and it's backed by a ton of research and science, that the best employers in the world invest in the well-being of their people and in a culture that supports this well-being. And when a company, an organization, an employer, when they invest in their employees, it drives authentic employee engagement, and that drives better organizational results. And so you can see that that's the sort of virtuous cycle we have here on this screen. And so we know that by helping improve the well-being of your employees, we're also going to help you reach those critical missions that you all have at your organization. And this model really is backed by what we call the, we have a Limeade Advisory Board and we have the Limeade Research Institute. And so these are all experts in their field working to help everyone eat, move, and sleep better through these fun core challenges that are offered. We also help improve emotional health, stress, anxiety, and depression, work and financial well-being. And so by doing all of that, we're able to improve those key performance metrics connected to well-being, which include things like employee engagement and turnover. And really our platform and approach is a pretty simple methodology. There's 4 parts. It's awareness. So we want to give employees some information about where they are now, what they're doing well, what they need to improve on, and we do that through the well-being assessment, and then also through some activities that drive awareness. We want them to be able to take action. So there's some recommended activities based on that well-being assessment, and there are also some additional ones that we know are important to the state of Washington overall and to organizations that we provide. There are some extrinsic and some intrinsic rewards that are offered along the way. So I think all of you are familiar with the various gift cards that you get for completing well-being assessment, the Amazon gift card, and then also the $125 reward for level 2 that gets you $125 into your HSA or against your deductible for the following year. And then we're all able to see insights on the back end about what people are using, what sort of things they're working on, where are the biggest areas of needs. And so we're also able to provide some of those at the individual level back to the employee so that they can continue to improve. Because at the end of the day, we really want to make sure that those employees, those people are learning about themselves, that they're joining these game-like activities, that they really are earning points and improving those habits so that we can continue to see that improvement that you all have come to know, hopefully love, and expect from us. And so, you know, we have, and we've shared this before, we're happy to share it again, but over the last few years, we've been able to conduct a number of cohort analyses that really show that individuals who are, well, so the population overall is maintaining or improving the health and well-being of all of your organizations, which we find great. We've also been able to do a cohort analysis that follows folks who have taken the well-being assessment year after year and participated in the program. And we've been able to find that those who are at risk are improving, and they're improving pretty dramatically across all of the dimensions we track. And when I say all, I really do mean 34 out of the 34 dimensions we track. And so we're really proud of being able to be a part of that. And we know that a lot of that success is driven by the Washington Wellness team and then really all of you at your site. And at the end of the day, we know that this improved well-being really does lead to more engaged employees. And by engaged employees, we're talking just at a practical level, folks who enjoy their work more, they'll intend to stay longer, they're more loyal to their teams, and they're actually more likely to recommend their organization as a great place to work. So we know this is a huge issue and one that we're able to play a part in. And in fact, about 30% of US employees are engaged per Gallup, and only about 12% of employees are engaged worldwide. So if you look at the flip side of that, about a third of employees are actively disengaged. So these are the folks who are trying to actually think, if you think about everybody sort of rowing in a certain direction on a ship, these actively disengaged are really trying to sink the ship. So we are all about trying to engage the employees across the spectrum and continue to get these great results that we've seen over the years. So as part of that, we're really excited to, moving on to the next slide, show some of the updates that we have for the Smart Health portal. And it's, I'm happy we're able to start with this page because this page is going to show you, I'm going to jump into a demo here and you'll be able to see some of the things that are changing
this is Justin. Sorry to interrupt you. We're actually just a little technical challenge fun here. We're not able to find you on the webinar list, so we just can show this slide. So if you could talk through this slide and then just sort of talk about the updates. I think that's how we're going to approach it. So does that make sense?
It does. Interesting. Okay, so
or we can steer, and you can just tell us what you want to do, but that might be kind of challenging. So.
Yeah, I mean, all of the updates that we're going to talk about are in the demo site themselves. And so let me just see if folks can hold for 1 second if there's anything I can do on my end. And you're not able to do anything at all, are you?
Yeah, thanks everybody for your patience. I'll try and work this thing out. So Bennett, you use your actual name, Bennett Blodgett, correct?
That is correct. So if you want to, why don't I just try to sign out and sign back in really quickly, and then maybe Justin, you can talk about some of the things that we've been able to share with you already, which are the replacing of these promotional bars with a really engaging featured activity, and then some of the Limeade interactive videos that we're going to be offering each cycle. And so I'll try to just sign out and sign back in and see if that solves the problem.
Okay, that sounds great. Okay, thanks, Bennett. So I'll pick it up from here for a couple minutes to talk about, so what we're looking at right now is what has been the traditional environment on the SmartHealth portal. And Bennett will be able to give us a demo of how this is going to change here in a moment, hopefully when he signs back in. But, traditionally we've had these, with these banners, SmartHealth banners, the SmartHealth banners up top here, you have the red one, you have 2 blue ones. And this is where we put the sort of high value items. So, we've had the Complete Your Wellbeing Assessment, the SmartHealth How-To video, and Celebrating Your Why, which is, has been our theme for the past couple of years, which by the way is evolving to Pursue Your Purpose, which is building off of that, that why, what's your why theme, which is really getting at that intrinsic motivator for folks. And so the way that this is transitioning is it's going from these sort of separate, sort of small, banners that you can click on and find out more information to when you have an event, let's say a marquee event like Smart Health Week or the Governor's Walk. We've already rolled some of these out here in the latter part of the year, so you may have seen this on the portal. That it's a big banner across the top. It takes up the whole screen, and it's just, you can't help but see it. And then you can scroll down and you see the rest of My Plan, et cetera, and the other activities that are normally there. So that's a design adjustment that I think is more kind of in your face in a good way. So it captures people's attention. And then Bennett also mentioned about the video capacity with SmartHealth Interactive, and that's really the capacity for us to show video within the portal and to also have quizzes at the end of this. And so this is not only something that Limeade is going to do. They have 20 videos that are set up for 2019, which hopefully Bennett can speak to a little bit more, maybe show us something about. But you'll see that when Susan, that's mentioned, and it's part of the activity library, and that's one of the resources that Susan's going to dive into here next. But it's really this opportunity to, teach people about wellness through video. It's much more sticky as far as like adult learning style with regards to watching a video and having questions at the end of it. But it's not only something that just Limeade would do, it's something that you all could do too as a custom activity. So if you're really looking for something new and creative and it's totally specialized to your organization, you would have to create the video content or obtain it somehow. And usually it's just a couple minutes long, but we could work together with Limeade to put those questions together at the end, so you have that cool new engagement feature on the portal. So I'm going to ask Aaron if he's able to.
Bennett is here now, so we can switch over to
okay.
him. Bennett, you should be able to talk now.
I can, thank you.
Okay. And let me give you presenter rights.
Wonderful. All right, so let me just find, can everyone see my screen?
Yes.
Yes, we can see it.
You can see the Share Your Happy Place activity front and center here, is that right?
Yes.
Great. So I hope that that sort of contrast between what you were seeing on that slide and what you will be seeing starting in January of 2019 is pretty clear right up front. And I know Justin talks through a lot of these. Again, this is just a demo site, so this is where we're able to demonstrate some of our functionality to you all. But we're really excited to be able to bring these updates to you. We've made a lot of investments in our user experience, which is really how do we make sure that people really love the platform and the product and they want to come back time and time again. So we've been able to do that through a number of ways, through activities in the past, through organizational support from getting leaders and others to really make sure that they're invested. And now we're taking that next step in the user experience piece. And so this featured activity really is all about bringing to life the things that are super important to the Smart Health community and be able to elevate culture in a way that brings folks together around certain things. And so, you know, if you're the banner here works similar to most activities, so there's actually an activity tied to it. And the Share Your Happy Place is a good one because it also demonstrates some of the things that you all have been able to get to see so far. So you're able to actually you can track things in here for the Share Your Happy Place, right, like that. And then there's actually a feed connection to it, which I don't believe is turned on this demo site, but we're able to connect those to the hashtag functionality that you all have been able to use in the Governor's Walk activity and other places. And so we're going to be tying that hashtag functionality to a lot of different places throughout the year, and we're really excited to keep that conversation going. The other thing I wanted to bring to life, I heard Justin talking about it. We're going to make sure to have a Limeade interactive video available at all times throughout the year. And so there'll be one for each of the cycles we do. And you can see it's in the product. You're able to just quickly click and then actually see a video on various topics. So I think you can see that they're all about 1.5 minutes or so. They're very short. They give you a lot of different information. I don't think the volume is actually working on my side, so they do have volume. And they're just quick ways to learn healthy things. And so we think, again, as Justin was saying, this is just a nice way to be able to show, engage folks in a way that is a little bit stickier for them and is a little bit more exciting. And so we obviously are here to help support if there's any sort of videos you want to do. So, you know, if there's something like one of your leaders wants to do something, one of your team members that are really encouraging folks, we find that that's a really good use of something. If there's an on-site event that you have video of that you really want to be able to elevate your culture with, that's another way. So we're just excited to be able to bring this to you all throughout the year and have this be another exciting component of the program. The other thing I just wanted to quickly touch on is, and I'm going to switch over actually to, this is the Limeade's program. So this is Limeade's actually in-house program, but some of the things that we're going to be doing with Smart Health are available right here. And so you can see that featured activity right up top, just like you all will have. But then there's some important changes to how we're going to be laying out the site. So right now you have you have My Plan, which has required activities like the well-being assessment and then things you add to your plan. And then from there are other things to do. And we, after doing really extensive user testing, are making some updates to that and adding some functionality with some machine learning that we're going to be able to provide actually top picks for users. And so instead of just providing recommended categories based on the well-being assessment, we're actually able now to look at the type of activity that any given user is joining and the type of things that they're liking by interacting with the site. So we're using an algorithm that really is trying to give specific personal choice to users. And so you might think of this like a Netflix or even an Amazon. Once the program gets to know you a little bit, they start recommending things for you based on the things that you personally like. And so this is a really, it's a very exciting component that we're excited to bring to you. I think for me, this is a place now where the program is really relevant to me as a user, and I'm able to participate in things that I really like. And as I interact with the site, you're able to provide feedback pretty quickly to the site, and it'll start to learn those things over time. And so on the app, this is you're able to see the thumbs up, thumbs down pretty quickly. And here you're able to go to that the 3 dots in the top hand corner. You can say yes or no. I like this sort of broad-based exercise, so I can say yes. So now that's going to provide me more activities like that throughout the year. if I feel like I actually do need to sleep more, but I have a couple of young children now, so maybe right now I'm not able to do this as much as I'd like to. So I can come in here and I can say that I don't like it. And so what that'll do is over time, those things will start to actually populate. So you can see that in my top picks for you, I just had that sleep one. I just gave it a thumbs down, and now it's been replaced. So you can see that the program is really responding to all of the activity that I'm doing. Beneath that, you have recommended categories. These are based on the well-being assessment. So if you think about it, there are things that are super important, like the well-being assessment placed in my plan. There are things that we think are super irrelevant to users based on our algorithm, and only then does it get down to the well-being assessment categories. And again, our user testing showed that folks really like this layout the best. They don't feel like they're hit with, okay, I just completed this well-being assessment and now I'm doing something somewhere else. So, and this will actually send you to a topics page, of which I think if you're familiar with the site, it's a place that has needed to be updated for a long time. It had a bunch of sort of outdated type challenges in there. So we're replacing all of those non-point activities with our entire science-backed MyMade library, and those are actually going to be worth points. And so it caps out at the top level of the point threshold. So for SmartHealth, we're at 4,000 points, and so you can actually only earn 1,000 points through these activities. So while you can do a lot of these and they're super relevant to you, you can't just pick and choose and go through each and every single one of these and earn your top level of incentive, in month one. We do have some guardrails on those, but we're really excited to be able to sunset some old functionality and add some new stuff in here, which is super cool. And then, of course, after recommended categories, there are the other things to do. So this is where those cycle of activities that you're all used to, which we've traditionally done on a quarterly basis, and this year we're going to do on an 8-week basis. Our science tells us you can start to build habits in that 8-week range, and the feedback that we've been getting is that we want to make sure that the program remains fresh for users. And so we're actually going to be moving to 6 8-week cycles throughout the year rather than 4 3-month cycles. So we're excited to bring a lot of this stuff to life and really change the user experience, make it fresh and exciting for all of you. So I'm going to stop there and see if there's any questions or comments, or check with Justin to see if I missed anything.
Yeah, Bennett, we do have one question. There was a question about if we could get a preview of the SmartHealth community page.
Yes, you can. So let me just, so the community page is live right now. So it's available in your program. Let me just switch over to the live site and I'll be able to show you that. 1 second. In the meantime, please let me know if there are any other questions that are popping up or any other commentary at all. I hope that you all are as excited as I am. I think that SmartHealth has been overdue for a nice facelift, and to me, this is just one of those things that really, I think we're going to be speaking more relevantly to users, but it's also bringing to an experience to users that is fresh, new, and really engaging. So I'm really excited to see that come to life. And I am almost there. I know you, hopefully you. All right, so can all of you see my screen again?
Yes.
Current SmartHealth site. So if you see up here on the toolbar, there's a feed section right here. You're able to just click on that feed, and I hope that all of you have been able to participate. So for instance, today, there's an activity around World Diabetes Day, and the activity is about wearing blue for diabetes awareness, and then posting photos so that folks can get to know people in their community, but also have awareness around diabetes. And so you can see we're using that hashtag WDD Washington for today. And so there are other things in here that are just basic conversations around what folks are doing on site or what the program's doing overall. So You know, I come in here pretty regularly just to see things like Hug My Son and Daughter, which are great ways to just let people know what you're doing and what's going on. So this is the Smart Health Community Feed. We're going to be making updates. We'll continue to make updates to this to add in some functionality as we go. And so we've just been really excited to be able to bring this to life this year and highlight a lot of the things that you all are doing and what's happening around the state of Washington.
Great, thanks, Bennett. We have another question about what feedback, and I guess we might be able to chime in on this as well, have we received on team challenges? Is there anything that you want to speak to that, either Justin or Bennett?
Bennett, why don't you go ahead and tackle that one first?
Yeah, we know at a high level, we know that one of the biggest places of support for well-being is what we call organizational support, and that's really just how are people in your community talking and supporting well-being in your life. So that can come from your manager, your boss, your coworker, and then definitely your peers. And so the team activities that we've been able to offer have really been able to bring folks together. And so we know we've been offering a wide variety of things, whether it's meditation or steps. And so that we continue to get pretty good feedback that they're good in building that community and bringing folks together and to sort of change up from years past. And so we're going to be offering, I think it's 5 team activities next year, which were similar to this year's. We've been able to refine a bit and make sure that we're giving the people what they want, but overall they still continue to be a popular activity. Justin, is there anything you want to add there?
No, I think that covers it from here. Thank you.
Yeah, and we're always happy to hear, if folks have ideas about how we can improve that or do things that are a little more relevant to your population. We're happy to hear that and continue to improve the experience for everybody overall.
Great. We have had a couple other questions come in, but just for the sake of time, we need to keep moving on. So I'll respond back to those questions and to those people at okay, I guess we're going to go ahead with those questions. One of the questions is, can I find out the percent or the number of employees using SmartHealth? The question to that is, yes, we can do that. And I think, Ken, you asked that question. I'll follow up with you about that and how you can get that information. Let's see. I love the variety. What is the first team challenge coming in 2019? Bennett, do you know what the first team challenge is?
Yeah, it should be it should be a steps challenge that we're offering. I can pull that up quickly as we move on to. If there are any other questions, I'll be able to pull up that calendar and tell you in no time flat.
Yep. I'm going to switch over presenters so that we can keep moving.
And actually, you know what, Bennett, can you go back to the SmartHealth community for a sec here in SmartHealth?
I can. 1 second.
I'm just wondering if anybody else has posted anything recently. Oh, look, okay. It's the Washington Wellness. This is a live picture of what we're doing in the room right now, y'all. Wow, I just dropped the mic. Just amazing, isn't it? So anyway, that's the second joke of the webinar. Hope you had a good time with that one. So go ahead, Bennett, continue.
I mean, there's nothing to say after seeing that blue turtleneck. You're rocking it.
I know, that's great.
Bennett, I'm going to leave you, Mike, but I'm going to switch us back over so that we're presenting.
Perfect. I am actually at the end of the content I have. Let me just pull this team activity up. And you'll hear, and I know there was a question about how to get real-time data. We'll be talking about insights dashboards here in a bit. So, and yes, I can confirm that the first activity, it's a team fitness challenge and it's a track 500,000 steps in that first, I think it's in, this doesn't have a date on it. I think it's in that first January, February period. But I know that the activity calendar should be live on the Smart Health resource page. I believe that's also included there already. You can pull that down and see what we're offering for the year.
That's correct, Bennett. It is live right now, and Susan next will show people where it's at exactly.
Great. Well, I am good on my demo part, so I'll be coming back to talk about data, but happy to answer any questions via email or follow up as well. So always here for y'all.
All right.
Thank you, Bennett.
Thank you, Bennett. Hi, this is Susan St. George. I'm the Washington Wellness Program Coordinator, and we're pleased today to be able to show you all the resources available for wellness coordinators in 2019. As Justin mentioned earlier, we have some new things for you, updated things for you. So what I would like to do is walk through the web page, and the first thing you may want to do is bookmark this particular web page because there are so many resources, and you'll see as we walk through, some of you, this may be a review, you might see some new things, so let's go ahead and do that. So, all right, you want me to, all right, let me minimize this. All right, okay, so, orange button. All right. So the first thing you see on the SmartHealth web page is that SmartHealth is Washington State's one secure website, and you'd really be able to enhance your worksite wellness program by using our resources. And we start out why SmartHealth. You can read through that. We have Governor Inslee's support. There's a couple of videos there, and a letter from Governor Inslee. There'll be a new one in January. And then how to get started. And you might notice right here, there is SmartHealth Web Access. This is something that if you're not aware of it, you may want to give your IT or web team because it gives them some of the technical details to make sure that SmartHealth is going to work for the staff at your organization. All right. As we scroll down, if you want to see some of the details about who's eligible, the rewards that are available, deadlines, etc., you can click right here on the PEB SmartHealth webpage and use that as a resource. Below that, we have the SmartHealth events, and these are, you'll see the new dates for 2019. We have SmartHealth WBA Week. That will be the first marquee event. And then going on down, SmartHealth Week, Governor Walks for SmartHealth, Leader Walks for SmartHealth. This is the place that as we get closer to those events, you will come back and find lots of tools and resources to help you promote each of these marquee events at your work site. And as we come down here, you see 10 different ways to promote SmartHealth. And we've listed them in order, starting with the easiest. So the first one are our flyers. So for instance, there's the SmartHealth Rewards flyer. There you go. And these are printable. We have the app flyer. This is a good one to promote using the SmartHealth app, and it lets people know exactly what they need to do to get the app on their phone. We have information about SmartHealth Community, SmartHealth Community Tips. You'll see both of these. You can click on those to learn more. We have the WBA completion thermometer, and this is something we presented last year, and this is a downloadable thermometer. The particular one I'm showing you, it prints very large. We also have the one underneath will print on 8.5 by 11 sheets, so you can tape it together. You are also able to, let me just see here. We can, okay. Let's go, okay. So be sure to notice the thermometers. We have videos. We still have the SmartHealth how-to video, but we also have a new video. So I'll just show you the beginning of it, which are SmartHealth stories. This is the brand new one that we just videotaped, YME videotaped for us during the governor's walk and during that time frame. So actually be able to. This is a nice one, and this will also be on the SmartHealth portal. You have access to that. Joel from Illinois. Let's see. Then we have stories. You can go in and look at stories that people have, successful SmartHealth users, some of the stories and things that they've been able to do and their success using SmartHealth. And then as we move down here, we have turnkey toolkits. And as Bennett mentioned, we will have 6 different time frames during the year. So our first one is January through February. And we have 2 different resources for each period of time in each of the tiles. The first one is, do I drink enough water? And so you have this, it is printable, and you'll notice if you click down here, okay, well, in the white area, when you download this, you will be able to fill in your own information up to 4 lines. So you might want to put your name on this, or contact information, or any special information you want to promote during that week. And then for each one, we also have a message. So the next thing about these resources is they're all ready to use. You can just go in here, find the one you need, and cut and paste or download it and use the messages you would like. So you see, here's the turnkey toolkit message for January and February. Do I drink enough water? It tells you how to use this. You can just cut and paste and send this email out to all the staff at your organization. Okay. So you can see we have actually the first 6 months here, so you can look ahead and see what's coming up. Something new that we've done this year, which I'm really excited about, is we have the SmartHealth Activity Tile Library. And if you remember before, in 2018, we had something that looked like this, which was an Excel spreadsheet, told you about all the activities. We've updated that for this year, and we actually have a SmartHealth library. And what's nice about this is that you have a table of contents. When you click on the item in the table of contents, it takes you right to that page. And we have all of the activities. For instance, you see our annual activities are at the top. So those are the activities that will continue through the entire year. When you click on it and go to the actual tile, you can see what the picture is going to be for that month. It will tell you the date of the activity, the name of the activity, all about the activity. And then the nice thing over here is that you can actually go here and see more about this activity tile, whether it's an individual activity. This one's going to be one time. It's a manual. You have to go back and say you did it. It also tells you the dimensions of the 34 dimensions we have in SmartHealth. It will tell you which one this addresses. And let's go back up here. So then you see that you have cycle 1, all the different activities during that time. Simply click on one of these. You're going to see the tile again. This is something that you can use as you design your own promotions at your organization. It gives you all the information. This one, the dimensions are energy level and sleep. So if you want to address something around that, it's a good way to see which dimension these are including. Anything else on this page? And so then we go through the week, through the year. The health observances are all in here. The team activities are in here. All of the activities that we have done and planned for the year so far are in here. And then once each cycle, there will be an activity that includes the video. So you can scroll through here and find those. So again, just, you know, it's so nice because you can just click, find what you need, be able to use that. Okay, let's go back over here. Okay. All right. I need, okay, here. That. Get me back to that one. Okay. There we go. Okay. The website. Here we go. All right, we're back to the website. The next section, health observances. So if you want to look ahead and see what the health observances are for 2019, you can open this and even print this out. So this will help you plan ahead to decide which health observances you really want to promote at your organization. We have team activities. The team activities for 2019. So if you want to see exactly what the team activities will be, remember these are included in the library, so you will be able to see exactly what that tile will look like. We have your custom activities, and these are something that you can personalize and do a special activity for your organization only. We have examples in here, and the nice thing about this actually is that it's easy to do. I know the first time I looked at the activity forms, let's see if we can get this one to open. Is it open? Oh, okay, thank you. Okay, there we go. It's really step by step. Something very important that we'd like to note is that this year, beginning in January, we're going to encourage you to submit your requests at least 30 days ahead of when you want to launch your activity. That's very important, so we have time to prepare that tile, to review it, and get it ready to go in SmartHealth. So please plan ahead. Make sure you've got at least 30 days, and it's fine to have more if you want to plan ahead. As you fill out the form, it's just step by step. You can enter your organization. That one is a drop-down box. So you can just pick whichever organization that you are, enter your name, your phone, your email. Then it's going to ask you what is the title of your activity, and it tells you how many characters, and it will stop you if you go to too many characters. Is this going to be a team challenge? You'll click yes or no. For the points, we have basically 3 tiers this year, and the first tier is 50 points, which is the amount of points that we'll use for weekly or smaller activities. 100 points for a one-time activity, and then we're using 150 points for a big event or something that you need to track by the end date. And keep in mind, if you do have something that you want to use more points, then we will look at that on a case-by-case basis and help you decide what the points will be. And what I found on this is that it tells you choose one activity, one based on activity detail. If you just want to highlight it and then highlight it before, and what you're going to want to do is save this form before you start filling it in. I didn't mention that, but you do want to save it to your computer. And so as you're doing the details, you can highlight them so we can see how many points you would like to use, the details for it. You have what the activity is actually going to be, whether or not it's going to be device enabled, so it can be tracked with a Fitbit or another tracking device. You start and end date. In the short description, you'll enter the description of your activity, and this is basically the basic things that you need to let people know. Then in the long description, which adds to the short description, you can actually add more detail so that everyone will know exactly what they need to do and have the resources that they need to do the activity. For your image, you can upload that. You can either put the URL, type that in here, or you can attach the photo that or image you would like to use with your request and send it to us. And then down here, Erin's done a really nice job of showing you all the different details of the activity and how to fill that in. So if you have any questions, contact your population health specialist. Okay, we'll go back. All right, and then let's see. We have, if you need help with presentations, you can contact us. And down at the bottom is all our contact information and related links. So be sure and bookmark this, go in, take a look. You may want to save some of these items somewhere that they're handy for you to get to. And watch for the updates, because we will continuously be adding new things to the web page. Okay. Now I need to go back to the slide.
Answer those questions.
Are there questions? And then I've got page 28. Okay, we're looking at questions. All right, and another detail that we want to remind everyone of are the 2018 Smart Health Incentive deadlines. Right now, people still have time to take their well-being assessment, qualify for the $25 Amazon.com gift card, which completes level 1, where they earn 800 points. But here's the really, really important part that you need to communicate, and we will be communicating out, is they must claim their gift card by 11:59 p.m. on December 31st. So you not only earn it, you have to claim it and copy the code so that you can use it on Amazon.com. And we can't emphasize that enough. We will be sending out claiming reminder emails to those subscribers that have earned the gift card but have not claimed it, so that they don't forget and they go in and claim it before that date. We will also be sending out general emails to Smart Health eligible members, and we will send a template for you as wellness coordinators to send out reminder emails. So make sure that everyone knows at your organization, you not only earn the Amazon gift card, you have to claim it by December 31st or you'll lose it. And then we also, reminder on the 125 reduction in medical deductible. Most everyone had to complete level 1, earn a total of 2,000 points by the deadline. If people are light users, they have different time frames, and you can find that information on the website or contact us.
Susan, we do have a question. Like, what are the major Smart Health events, like Smart Health Week, et cetera, that are not during Public Service Recognition Week? Hopefully we don't have any during that time.
Okay. I don't think we do during Public Recognition Week. I did do a lot of research to make sure that we would have our Smart Health marquee events during weeks when something else was not going on. However, a lot of organizations did not have their calendars up when we needed to set the dates. And the key marquee events, the first one we have is the Smart Health WBA Week. This is a week that we celebrate Smart Health and also complete well-being assessments. And those dates are back on the website. You see all that and watch for that because all the tools will be on there. The second one is Smart Health Week. That will be the first week of June. And then the Governor Walks for Smart Health That one probably in July, and then the leader walks in August and September. Okay. All right. So with that, if we have more questions, we can answer them at the end. But with that, I'd like to turn it over to Pam Walker to share information about coordinator training and technical assistance.
Thank you, Susan. And so, yes, this is Pam Walker, and I'm also a health promotion consultant on the Washington Wellness team. And I'll be going over today a little bit of background specific to our training process and the development of it, looking at where we're at currently with training and resource development, as well as what we're going to be bringing in the future for 2019, and just give you a high-level overview of our overall training format and the different aspects and how we hope to deliver this training so that we can reach throughout the state more consistently for coordinators and wellness committee members and champions to receive the training that we provide. So going to the next slide, Justin touched this has been touched on already as far as the training and technical assistance, that being charged to Washington Wellness, mandated to for us to provide and develop the training and assistance overall. So all I'd like to add here is that yes, we indeed were given a list to develop the designation program, to provide the structure for that, technical assistance, support and training for agencies, and of course that goes into a more inclusive role and offering all of that also to higher ed and other political subgroups and such. But I just want to stress that your ongoing input through training evaluations, we conducted a series of key informant interviews in 2017, and just unsolicited comments and input has been so critical and valuable for us, for ongoing improvements and helping inform, our training and what we offer you folks. So on to the next slide. Thanks, Erin. So when the executive order, when it hit the ground and we needed to get busy and start developing the designation program, and again, along with that, training, resource development, et cetera, and all that encompasses, we need to look at, the science in worksite wellness and best practice guidelines and promising practices. And so we really kicked off a lot of our training focus, and it continues to this day, using the set of standards in worksite wellness programming. We call them, of course, our wellness roadmap, 8 standards, and using those to help develop, implement, and evaluate training and resource development that's going to provide you with the information, the tools, and resources, to help you meet one or any combination of those 8 standards. So that's very much our foundation and our framework that we look at closely when we're developing and perhaps looking outside of our resources at existing trainings, again, that can support you meeting these standards or making progress in them. Along with the 8 standards, we have the ZO8 Award to give us the opportunity to highlight and celebrate your progress and accomplishments tied to meeting the standards. So that's an important piece of that as well. And then just as Bennett unfolded today, all the great new enhancements and things that we can look forward to with SmartHealth in 2019, we've ongoingly through the enhancements, different functionalities, programs, et cetera, through SmartHealth have provided training and guidelines for that and updates. And of course, we are continuing to do that. And then lastly, I just wanted to share as far as, kind of where we're at currently, the Employees and Retirement Benefits Division, very much a focus is to keep healthy people healthy, reduce risk, and provide, tools and resources and such to help folks manage chronic disease. And chronic disease is very much been a focus and will continue to be a focus as far as developing further training to help you, include programming such as the virtual diabetes prevention. That we have great tobacco prevention and cessation programming benefits, wellness benefits to really help with those two areas of chronic disease management. And so we are continuing to work and focus in that area as well for training. Okay, so before I kind of kick in and share more of what you can look forward to in the future for training and resource development, I wanted to share with you generally the format that we're using and will continue to use for bringing you training. And so, we always want to kick off the training explaining the why, that segment of delivering a training to you. Why is this subject, this topic important? We'll give, current information, guidelines, data, examples, evidence-based practices, et cetera, to help you understand, the importance of that topic and that focus of that training. And then the second section of the training would involve the how. So that would be giving you examples and reminding you or bringing new examples and resources as far as, what are the tools and resources that you have to address this particular topic, focus, health situation, et cetera, in your worksite wellness program. And then the what, that will also involve resources such as toolkits. For example, with World Diabetes Day today, we provided you with a toolkit, and on the September 17th training, of ideas and the tools and resources you would need to promote today and to promote awareness and the importance of, diabetes awareness and kind of help kick off, the New Year program. So this again is just to kind of share with you, we want to share the why, how, and what when we deliver training for you folks.
And we do have one question about
certainly.
The Zoe application. Do you know what it's due in 2019?
The Zoe application? Well, we've historically in February, has there been a different decision on that? Pardon me? Oh, okay. Evidently, there hasn't been a definitive date set, but we'll be sure to keep you informed and give you plenty of notice for that due date. Okay. And then moving on to how we're delivering training to you and what we hope to continue to do and improve on into 2019. Of course, we'll continue to focus on in-person training, such as quarterly presentations. For example, the diabetes prevention presentation that we implemented to you folks in September, we're hoping to continue with those type of presentations. And we also are hoping to get back to, providing webinars on an ongoing basis, and along with the in-person trainings, providing a live webinar at the same time. And then, of course, hopefully archiving that for those that weren't able to attend either via webinar or in person, so that they can access the training, when it's convenient for them and receive the information. Of course, we'll continue to go on site, Ron, Aaron, and I, to deliver an on-site training based on your needs and interest. And then I wanted to share with you that we're excited about the e-learning training that is available, and it is the Healthcare Authority for supervisors and managers wellness programming. on the learning management system. It's available now, and that was done in partnership with the Health Promotion Resource Centers at UW. And for those that do not have the access or have the LMS, the Learning Management System, LMS, we can provide you the content and help you utilize that information and offer it to your supervisors and managers. So for you higher education folks, if you're interested in that, please let me know, and we'll do our best to provide the content and help you get that available to supervisors and managers on your campuses. So looking at more closely at an example of the SmartHealth ongoing training and development, one of the first pieces that we'll be providing you in the new year is training on a SmartHealth data dashboard update. And if Bennett is still with us, are you still with us, Bennett? Perhaps not.
I'm here. Nope, okay. I'm here. I just want to make sure that I was unmuted. Yeah, yep, I can. So one of the great things that we've made an update to, and that we'll be rolling out over the next, hopefully in the next week, actually, we'll be able to get everyone access to it so you can start using it and overlap with having the old dashboard so you can get used to this new dashboard. We have a new, what we're calling the program summary dashboard. And so, one of the pain points we know from folks is that the Insights dashboard is only updated weekly. And so the new dashboard is actually going to be a daily update of those very stats that there was a question about earlier. So you're going to be able to see, registration, WBA completion, participation activities, monthly active users, which is a key statistic for us to make sure that people are coming in and changing those habits. And so not only are you going to be able to get those daily updates, but you're also, as I hope you can see in the slide, where we've done an overhaul of the user experience. So we've redesigned it to really make it much more intuitive and pleasing overall, so that hopefully for those of you who are giving reports or presenting out, that you have something that's just ready to use right off the shelf. And then of course you're going to be able to just dive into each of the data points like you always have with your existing dashboard. And so there will still be, you'll still be able to see trend lines, do user group comparisons, see incentive level completion, and then you'll be able to export that data and really be able to have some insights on what's going on with your population and adjust either your program accordingly or ask that we do a targeted activity here or there on your behalf as well. So we are going to be holding trainings on how to use the program summary. One of the things we know, there are some of you who are currently subscribed to weekly emails that give you your data for the week. Those will go away, so you actually have to go into the program summary, the new dashboard, and resubscribe so that those will start coming each week again. And then we know that because this is daily data and the current one is weekly data, we know that there will be some differences in the data for the next probably 6 weeks, as you still have that old dashboard. We've done actually about a year's now worth of validation on the data in the program summary and feel extremely confident in that. So it really is just that difference in when we're pulling in data and how it's tracked. So just know that as you're getting up to speed in the new program summary dashboard, you might see some small discrepancies there. And then we are scheduled to sunset the old dashboard 12/31. So we will do everything we can, have those trainings, and make sure you're comfortable. Limeade obviously is available to work with Washington Wellness and with you directly to make sure that you have everything you need and that you can get the information you need to run your program. So yeah, I think that's it on my end. Are there any questions or clarifications that folks want to need?
We're checking for any other questions on that, Bennett. while we're doing that, there was a question regarding the title of the e-learning, why we call it the HCA Manager Training as opposed to the Washington Wellness Manager Training. It's all that stuff.
Yeah, that's an excellent question. So DES is the one that administers the LMS program, and they have conventions about how they name things, and I worked with them and asked if we could name it something different from HCA Wellness for agency supervisors and managers, and they said no. So that's why we have it named starting with HCA. That's just sort of the way that it goes, but it is available to everybody. It's about who authored the training, and so that's what goes in front. So you'll notice there's a lot of other ones that have DES in front because I do a lot. We have now this one that says HCA in front, but ideally it would have not had HCA in front.
And Janet, one other question for you was the new data summary. Will that be defaulted to the current year for 2019?
Sorry, you cut out a little bit. The question was, would it what?
The new data summary, will that be defaulted to the current year for 2019? Like from the old dashboard to the new dashboard, I think is what Kim is asking.
Yeah, it should default to whatever the current year is. So
okay,
you'll be able to, once you first get in there, you'll be able to see data for 2018, and then when it's 2019, it will go to the current program year, and then in the upper left-hand corner, there's a way to filter to look back in previous years.
Okay, great, thanks.
Okay, my final slide, and the one I'm most excited about, is looking ahead into the future, 2019, and providing you hopefully interactive and stimulating, engaging, and relevant, as the slide demonstrates, training that will really, help you further build and sustain your worksite wellness programming. And so I wanted to give you a bit of a sneak preview and what's on the calendar thus far, and what we hope to, continue to work towards providing you, throughout all of 19 and ongoingly. So as I shared with you, we developed and continually look at the science of worksite wellness, what's best in promising practices, what topics are relevant, what's having impact, etc. But again, please know that your ongoing input and feedback is absolutely critical as we move forward. So it's just an open invitation, and I'm generally the lead for training overall, so you can always reach out to me if you have, a certain request or interest or questions. Please feel free to contact me directly. So looking ahead then, as I alluded to just a moment or two ago on another slide, that we're hoping to continue with quarterly presentations. And I guess our first technical one was the September 17th training, the diabetes prevention training, where we had guest speakers who were expert in that area. We had a great preview and overview of Omada, the diabetes prevention program coming to us in January, and then provided you with a toolkit. And based on, for example, the key informant, some of that input, as well as other evaluation data, you folks have been asking for more comprehensive toolkits and resources to promote different wellness programming, wellness benefits, etc. So, and I guess hopefully today, hopefully some of that's happening, but I would love to hear, for those of you joining us today, if you utilize that toolkit at all, if you have any input for me or guidelines or feedback for improvement. That's so important to us because we very much want to bring things that are relevant and important and really going to support your programming. So the next quarterly presentation will be in 2019, and it's scheduled in March, and it's on tobacco. And I have the great opportunity to work and collaborate with the tobacco program at the Department of Health. They will be there. It will be a very similar format as the diabetes prevention program. They will share the why, again, that first part of the format of training. Why is this important? Data, what's its impact in the workforce, the workplace, and cost, productivity, et cetera, and some really interesting updated information in the world of tobacco. And I've certainly gotten a great update from starting to work with them on that. And then again, what is available currently, the tobacco cessation and prevention benefits, wellness benefits at no cost to eligible employees are excellent resources that are unfortunately underutilized, and we really want to improve going into 2019 on those resources and increase utilization, because tobacco and tobacco use and its negative impact is still very much in the top 3 as far as health morbidity and mortality. So we're going to go over the benefits. We're hoping to have some guest speakers from Optum, with the Quit for Life program, for example. So we're continuing, to work with partners that can come and present and revisit the great resources that are available. And then we'll end with the how, and hopefully have some good toolkit resources for you to take. And for example, look ahead and plan for in May, there's a World Tobacco Day. Just as there's a World Diabetes Day, there's also a World Tobacco Day. So again, and that also is in line, that tobacco focus, with our efforts to address, the chronic disease management piece of our focus. More to come on quarterly presentations. That's the next one that is well underway in planning and development. And then we're going to continue to look at collaborative opportunities. We've been working with Kaiser Permanente Northwest, Kaiser Permanente Washington, and regions to continue to explore training and resource development opportunities, so that we can, again, bring the experts and really valuable tools and resources to you. And on one, how I want to say this. So one example of a collaborative opportunity that we've been able to bring to you towards the end of this year is the mental health first aid trainings. That's an example of a great partnership, primarily with the Educational Service District 112 down in the southwest area of the state, as well as Franciscan Health in the Tacoma area, through grant initiatives on a federal level. They've been able to extend us, the opportunity to offer you and your wellness committee members and employees overall the certification for mental health first aid training. So we've had a couple of those so far, and I have 3 more scheduled in 2019, and we'll be sure to send out, the details and the opportunities for you and or your staff perhaps to attend one of those. And then, of course, we have our yearly Healthy Worksite Summit, and we always want to spend our time with you and our session with you folks, so that it's something that, again, you feel is relevant and of interest, and you leave inspired and raring to go, and can take with you what Justin and I call your golden nugget, that, one great thing you can go back and put into practice. So we're beginning to really look at, how we can spend that time with you in 2019 at the summit. But again, let me know if you have some certain areas or ideas that we could consider to bring to you during that time together. And then, as I touched on already, the ongoingly SmartHealth series of trainings, just as what was done today as part of this training, updates, program changes, functionality, enhancements. Boy, there's a lot of exciting things coming down the pike as far as a great resource and tool for you to continue to utilize in building and sustaining your wellness programs. So that's very exciting, and we'll of course continue to provide those series of trainings. And as Bennett shared with you, the dashboard data is going to probably be the first one to kick off and give you. So,
Pam, speaking
yes.
of the Healthy Worksite Summit, we have a question regarding scholarships.
Okay, and Justin, you want to speak to that? Because I know you recently heard back as far as our request for those, and you heard back on where we're at with that.
Yes, thanks, Pam. So we're very excited on the, I think it's the third, what is it, March 20th, 21st?
20th and 21st.
20th and 21st, up in Linwood is our Healthy Worksite Summit in 2019. This year we're going to be able to offer 80 scholarships. So stay tuned for how we're going to be, so don't inundate the inbox with questions. We're going to be proactively in the next couple of weeks here sending out a message about how we're going to offer those scholarships and help as many people to get there as possible, while of course prioritizing those hopefully that have the most need. But we only had 40 last year. We have 80 this year that we can offer, so that's a great thing.
Okay, so that's it as far as all this information we've given you today. Are there any other questions specific to training or anything else with the time that we have left?
We don't have any. Susan?
I have one additional note is beginning in January 2019, we are sunsetting the Wellness Coordinator SmartHealth tile, so you will no longer see that on the SmartHealth portal.
Okay, great. Are there any other questions, Aaron, that have come in? Okay, well, I just want to thank everybody as we have 5 minutes left. I'll give you 5 minutes back. So thanks for spending a couple hours with us going over these important updates for 2019. I want to thank everybody here and online who have presented today. Very much appreciated. And if you have any questions, if you go one more slide, Aaron, you probably know this by now. You can contact us at wellness@hca.wa.gov or the phone number there if you have questions. So thank you all and have a great day, and we'll be in contact soon. Take care.